Well, good morning everyone and welcome to Better Health. This week we're speaking about breast health, and we've got with us naturopath Janet Schloss. I always say that wrong, I'm sorry. Now, Janet's a naturopath there at the Pilates and Healing Centre. She's also at the moment completing her PhD at the School of Medicine, and of course Janet, you were probably my biggest inspiration going through college as one of my lecturers. So
wow, that's a big honour.
It's an honour to have you here, and you know, very happy to have you coming in and helping us out with such an important issue. Can you talk us through some of maybe the problems or the conditions that women need to be aware of with breast health?
Yeah, probably the one that most of them need to be aware of firstly is breast cancer, and I think everybody is very aware with the amount of publicity that breast cancer gets.
Yes.
In relation to that, because there's quite a high population that get it. It's actually 1 in 5 ladies actually get breast cancer. Obviously men can get breast cancer as well.
Yes.
But some of the other problems the ladies get is also cystic breasts, where they do need to get checked quite often.
Yeah, yeah.
So,
now, is that something that they can do themselves, or?
They can do themselves, and I would encourage every lady to actually know their breast very well and do their own breast examination. So if they notice anything that is slightly different, then that they can go to their doctor straight away. But they still do need to get checkups on a regular basis with their GPs, and unfortunately it starts early, and I'm talking about some ladies are getting breast cancer from the age of 25.
Wow, really?
Yeah.
Really? So now when you say, you know your breasts and do the examinations yourself, what specifically are we looking for? Is it you know, painful areas, or are we just looking for lumps and bumps or redness, or?
It's mostly lumps and bumps. Most breast cancer isn't painful.
Yep.
So, and even with cystic breasts, they're not normally painful, they're just uncomfortable. So what you're getting to look at is if there are any lumps, any irregularities around all the different areas of the breast, and making sure they've got their arm up as well, looking underneath there, as well as their actual breast area, and in through their chest.
So in through the armpit as well?
If there is any redness at all, if there's any hot spots, which could actually be mastitis, but still it's something they need to be aware of. They also need to make sure if there is any leakage from the breast, the nipple, because that can also be a sign.
Are there any like types of discharge or whatnot that we need to look for?
Oh, milk, definitely. But if there's blood, then it's a definite sign.
Sure, sure. And now when you say that there isn't always pain, does that mean if there's no pain, then it's definitely something we need to be very worried about?
No, not necessarily. A lot of the cystic breasts or lumps that in breast that are benign are still not painful.
Yeah.
So, but it's better to get them checked and make sure than leave them alone.
Yeah, absolutely. So on the other hand though, if there is pain, does that mean it's not so much of a problem, or?
No, not necessarily either. I mean, the same thing, like there's no right or wrong, unfortunately. So, like I said, most breast cancer isn't painful, but if there is pain, that still also needs to be checked out.
Okay, not a problem. So, who is mainly at risk? Is there a certain part of the population that should be more wary, or?
There's certain risk factors for breast cancer.
Right, what are they?
Now, number one is alcohol. High intake of alcohol is actually been linked with breast cancer. Right. If there's breast cancer in the family, although a lot of people who first get breast cancer, there isn't a history, but definitely ladies who've actually got breast cancer on their mother's side originally, but now they also find that sometime on the father's side it is also linked. Okay. So those are the two highest risk.
Yes.
Other than that, there can be a whole range of different risk factors, or who can actually be at risk. Ladies who had early periods, long periods of estrogen exposure. There can be ladies who haven't had a child and breastfeed, but you know, in saying that, that doesn't necessarily mean that they're also going to get breast cancer. Everybody just needs to be aware.
Sure, and like you said, it is certainly something that's more growing within the population at this point in time.
Absolutely. Okay,
so we might take a quick song break. Thank you, Janet. Thank you, Richard, as well. And we'll speak to you soon again on Better Health.